I got to Charing Cross and there was a fire alarm at Charing Cross, so I had to find another tube station to get here. But I'm very glad to be here. And what I'm going to talk about in my session is the role of leadership, and specifically what we're doing in the Department of Health to foster good leadership, to take forward the personalisation agenda and the reform of social care. So what I'm going to cover is I'm going to just briefly look at the case for change. I know you will be familiar with the case for change, but I think worth just having a look at it. And then go on to some of the specifics that we're doing within the department. So, case for change. First of all, the demand for adult social care in England. And this slide just gives you a pictorial view of how basically social care now touches all our lives. I won't take you through slavishly, but the sort of top blue box, 19% of men and 34% of women will need residential care during their lifetime, and this is people who are 65 now, so 3/4 of the population. 48% of men and 51% of women will need some sort of domiciliary care, and 33% of men and 15% of women won't need any care at all because men die earlier than women. So social care basically touches all our lives. It affects a large number of people, about 310,000 people at the moment in residential care, about 60% of those supported by councils, 40% self-funders, 680,000 receiving domiciliary care. Enormous workforce in adult social care, about 1.8 million people we estimate, and will need to grow over the next 10 years by about another million people, and then around 5 million carers of friends and family, so the so-called informal workforce of social care, so enormous. This slide just gives you an impression of the pressure in terms of the rising demand. So the increase is driven by an increase in numbers of older people, and you'll see there 14-15, 1.3 million people aged over 85, rising to 1.9 million by 25-26, and what we know is that 1 in 4 of those people will suffer from dementia. Increases in younger adults with learning disabilities. And the unit cost is anticipated to rise by about 2% a year in real terms. So 15-16 figure just over around 15 billion up to 23 billion pounds in 25-26. So what's the government doing to respond to this? Well, it's called the Care and Support White Paper, and now it is the bill that is going through Parliament. I think the key thing around the underpinning of the White Paper and the underpinning of the bill is this clear vision that you'll see on the left-hand side, and 2 elements to the government's vision. One around promoting people's independence and well-being by preventing them. By enabling them to prevent and postpone the need for care and support, so the upstream activity, and then secondly to transform people's experience of care and support by putting them in control and ensuring that services respond to what they want. And what we'd like is the individual citizen to be the arbiter as to whether they receive a good service. So what we've generated then are these I statements, in terms of these I statements representing what it is to receive a good service. So I think you can see through the case for reform and the challenge of the reform programme, and this ambitious vision and this ambitious definition of how we'll measure our success in meeting that vision is really needing robust robust leadership and leadership development. This slide then gives you, just in one slide, the key elements of the Care and Support Bill, which is going through Parliament at the moment. It consolidates all legislation. It's the first time we will have a piece of legislation around care and support that pulls together all of the legislation. For the first time, it's built around people rather than services or conditions and needs or disabilities. At the heart of it, it has a duty of well-being. We want to make it clear and navigable for individuals, treats carers in the same way as people who are in need of service, modernises the law so that we're able to move from where we are at the moment, where we're trying to squeeze what we want to do and our thoughts around personalisation, for instance, into the law as it stands, to a piece of legislation, a piece of law that actually will support us to achieve what we want to do. As you will have seen from the earlier part of the presentation, workforce is really important, and we have 4 elements of our reform programme for workforce, and I'm only going to, in this presentation, because it was what was asked to do, is to focus on leadership, but I just thought I'd put this up so the capacity in the workforce to be able to meet those demands, the capability, what do we need the workforce to be able to deliver in terms of meeting the aspirations of the bill, meeting the aspirations of service users, to meet the technological challenge, leadership, and then finally social work reform. I'm passionate about leadership, and I know Andrew is passionate about leadership and the importance of leadership. If we don't get the leadership right and we don't get culture change right, then I firmly believe we won't be successful in the mission that we're on. So the research tells us that there's a strong link between good leadership and high quality. Earlier in my career, I worked for the Social Services Inspectorate, and we did a piece of work around ratings for councils and a variety of other things like structures, etc. And basically, it didn't matter how you'd structured your service in terms of the delivery of good ratings. It was the leadership that was the magic ingredient that delivered good, high-quality services. So I think we've known this for a while. Important in the white paper and important in the bill. And I think we have started to change our views around leadership. I think the sort of traditional model that we've followed in the department is very much concentrate on the top of the tree and the rest will be okay. So we spent quite a bit of money and resource on developing strategic leaders. Our focus is very much starting to shift now to say strategic leaders are important, but of equal importance is practice leadership, that frontline leadership role that in social care, very importantly, the registered manager delivers. We're working very closely with the National Skills Academy, which is our body that we set up to improve leadership in social care, and we think that there's more than green shoots, we think, in terms of some of the ideas and some of the thinking in the white paper now being translated into real action. The example on the slide is the graduate scheme that the the National Skills Academy has delivered for us, I think, into its third year now. First time in social care that we've had a graduate entry route into the sector. Small, but I think influential and important. So to give you a little bit more granularity then around some of the detail of what we do, and we had the first meeting yesterday afternoon of a new body called the Leadership Forum for Social Care. That's chaired by Norman Lamb, the Care Services Minister. And the purpose of that meeting is really to hothouse innovation around leadership, to provide some strategic steer around what we ought to be doing in the in the leadership space, and also not just to look within health and social care, but to look broader afield at different sectors and what are they doing around developing the very best leaders. What's the international experience around leadership development, so we can capture that, we can bring it in the sector, we can start to do something about it. I spoke earlier about the importance of registered managers, and this year we've launched a registered managers development programme through the NSA, and that has 3 elements to it. First, giving access to registered managers to development opportunities so they develop as leaders. Secondly, to give registered managers access to a helpline for them to check things out, to ask questions, to seek support, and also to mentoring and eventually some coaching support for them. And then finally, some seed corn money to set up local networks of registered managers. The NSA did some research for us around registered managers, and they did feel a beleaguered bunch. They did feel an isolated bunch. So we're working hard directly with registered managers to try and support them. And that initiative actually was launched again by Norman Lamb, who does see leadership as a priority, and it was launched within a care home, an ideal care home up in Leeds, and a good event it was. Third element that I want to touch on is around collaborative leadership. You know, we live in a world of integration and a considerable drive towards integration. Again, leaders are going to be really important in being able to bring together that collaborative systems approach. So we've been doing some prototyping in 9 council areas with councils with their partners, and we're looking to roll that out. In fact, we've got the bids in at the moment across 20 to 30 areas across the council, across the country, and we're also looking to hopefully adopt that same model with the pioneers when the pioneers are announced in September of this year. I've obviously should have looked more carefully at my slides, because that tells you some of the things I've just told you. So I'll just skip on from that. In terms of framework around leadership, I wanted just to dwell for a minute on, again, something that I think is really important. Who has seen in the audience the leadership qualities framework? So I only a very few people, actually. I'd really urge you to have a look at this leadership qualities framework. The NHS launched its leadership qualities framework probably a year, 18 months ago, and we thought this was something that was really lacking in the social care world, actually being able to name what was important in terms of leadership and name the behaviours that were important. Because one of the purposes of this leadership framework is for then individual managers, the managers that they lead with their own line managers, to actually look at their own leadership and look at where the strengths in their leadership might be and where the deficits might be, to drive their own development programs. Because in social care, we've got something like 23,000 different employers. 80% of those employers employ 49 or less people. So it's not simple in the NHS, but it's certainly much more simple than in social care in terms of being able to spread these ideas around a focus on leadership. So I think this is a very good product, a really good underpinning of a development journey for a manager, and a good self-assessment tool for, say, the owner of either an individual care home or the owners of Four Seasons or whatever it might be, to be able to benchmark and look at their own leaders. And I think Debbie Sorkin's speaking tomorrow, and I think Debbie will, if you go to her session, will spend a bit more time talking to you about this. The other publication that we've made, and this is, I think, this last month or the month before, is this Leadership Starts With Me. And again, just do a quick straw poll. Who has seen Leadership Starts With Me? 1, 2, 3, 4. So again, only a very small number. So well done those that have found it. leadership starts with me, I guess, is what it says on the tin. This recognises that in social care and the diversity in social care, actually all of us occupy a leadership role. It isn't just me in the department, Andrew with his many hats on, Duncan, directors of adult social services. All of our staff have got a leadership role, and our strategy needs to address this. So what leadership starts with me does is it's our leadership strategy for the sector. So again, I'd urge you, if you've not seen this document, to go and have a look on the internet. I've got 2 copies down there. They come in a nice little sort of A5, is it? A nice little A5 book, very, very accessible, written for everyone to be able to understand and start to use. I've talked a little bit about the collaborative leadership programme, but a little bit more on this. It is a genuine collaboration, because we thought if we're looking to encourage leaders out there to collaborate, then we need to collaborate at a national level. And again, being honest, we're not always that good at collaborating. So this is a collaboration between the Skills Academy, with the Department of Health, with the NHS Leadership Academy, with Public Health England, with actually the leadership body for children's services as well, the Local Government Association, the Association of Directors of Social Services. And this isn't just people signing up saying collaborative leadership is a good thing. This is actually people bringing a bottle to the party, actually putting some money into this initiative. So all of those bodies that I have talked about have put in significant investment into this project, as well as bringing in investment in kind. So you will see an evaluation. Best place to have a look for this sort of stuff is on the National Skills Academy website, and it will be rolling out. We want to roll it out to that 20 to 30, but ultimately we want to roll it out across all areas in the country, focused around the health and well-being boards, so we truly get that collaborative way of working. Oh, actually, I said my papers were down there, but they're not. That's what the Leadership Qualities Framework looks like, and that's what Leadership Starts With Me looks like. Other leadership initiatives that we're engaged with, one around black and ethnic minority leaders, very much around how do you start to deal with the glass ceiling, to recognise the glass ceiling, to help people get through it. And that's based around mentoring. And again, in terms of times of austerity, not always money to spend on these things. So that's also based around reciprocity, with people coming forward and saying, well, I have succeeded within the system, and I want to give something back now. I want to mentor a more junior manager, a manager that's really striving for that next level, but probably needs a little bit of help. And that programme is going to run again, details on the NSA website. Following on from Winterbourne and from Francis, we're doing some work around leadership at board level. Because again, if you looked at both Francis and you looked at Winterbourne, that was considerable failure at board level, because those boards were looking at how did you become a foundation trust, how did you make the maximum amount of money, rather than looking at care as a business. And both those organisations were care organisations. Care was their business, and their boards weren't focused on that. So piece of work around board level development. A piece of work around how do you recruit for values, again following on from Francis, but also from Winterbourne, that we want to make free to employers to be able to use. And then some programmes, a frontline leaders programme, an emerging leaders programme, and a new programme commissioned by ADAS for Association of Directors of Adult Social Services for new directors, again so that they can hit the deck running in terms of the important roles that they hold. So I've gone through quite a lot of material quite quickly. So here is the conclusion. I think it's all our business to improve the quality of leadership, particularly at the front line, because if we do that, I think that is the precursor to the quality service that we do want to provide for people who use our services. We do need leaders who don't just work within their own systems and their own organisations, but view the system as all of the organisations working together. That we are committed in the department to taking this forward. We are committing to shift the focus much more to practice leadership. And what underpins all of this is our values and the behaviours that we exhibit. And again, I hope you'll see that as a theme that runs through our work in trying to recruit for those values and then support those values and those behaviours as they develop. So that is the end of the presentation. I'm very happy to take questions.
We have a roving microphone, so if you'd like to ask a question, could you say who you are, and we'll get started. If I could just ask you a question while people are thinking about it, Glen, which is really around one of the strands of this workshop is around personalisation. I just wondered if you had any reflections on the leadership for personalisation, because it's particularly challenging. It requires you to think in different ways.
I think the key around personalisation, sort of, and increasingly, is that it's not an add-on. It's not something we do on the sort of side of our main business. It is that it needs to sit at the heart of the way that we run our services. So it's personalisation in terms of you have a direct payment or you have a personal budget. It's personalisation if you live in a care home or you receive a domiciliary care service. I spent a day a couple of weeks ago with Servacare, a dom care agency, and their chief exec was sharing some of the referrals that he received from councils. And he went from a London borough that will remain nameless, that just basically had a name, an address, and a date of birth, and 15 minutes in the morning, not what the 15 minutes was going to do. To, and I will name them, Wigan Council, that had a referral form that was around the outcomes to be achieved for the person who the referral was about, and then a sum of money, not a level of activity. So I think personalisation has got to be at the heart of all we do, and it's got to be the culture that we operate in. Hence the focus around leadership, because it's about leaders then getting that vision and being able to put that vision into practice.
Thanks. I think you were.
Councillor Barry McLeod-Cullinane, London Borough of Harrow. I just want to ask about the move of public health into social care situations. We've now got public health coming over to councils, much more democratic control over that, and that link up with leadership. You're talking about primarily officers. How do they interrelate to the democratically elected local councillors, and making sure that the councillors themselves have got the right level of skills, expertise and leadership, and integrate with the managers on the ground? How can we actually strengthen that side of things? Because otherwise you will get things drop through the gaps, the wrong priorities being set and so forth.
Do you want me to respond, Andrew? Yeah. I don't know if people hear that question around members and officers working together, and particularly in the context of the public health function coming into local councils. And I think a good question. I think we would see the answer as being through health and wellbeing boards, where elected members will be part of that board, will chair that board, often at the level of leader, with the Director of Public Health being around the table along with CCG colleagues, other chief officers from the department, and the crucible that hopefully the Health and Wellbeing Board will be in terms of understanding local needs, that understanding then being translated into the commissioning plans for that locality. And what we would want to encourage from the department then is that there is then a workforce and leadership element. So you work out what you want to do, what your commission intentions are, and then what is the workforce and leadership implications of that. We do work quite closely with Public Health England. In fact, it's been the Director of Organisational Development that's done a lot of work for us around pulling that collaborative leadership piece together. But very much it is a new world, and we are going to have to learn as we go on in the new world around what works and what needs more attention.
Time for one more question, I think, if anybody's got one. Looking around the room. Yes. It would be over here, which is the furthest away from the mic. Thanks. Again, if you could say who you are.
Hello, I'm Helen Allen from Community Catalyst, and we support people to set up tiny little enterprises locally. Many of them don't fit regulation, they're not registered managers because they're just doing quirky and creative stuff. Are the leadership frameworks kind of very much centred on more traditional resi care, dom care, or is there kind of scope in there for people who are perhaps aren't delivering a registered service? They might be doing some personal assistance. Do you know what I mean? In terms of the world of personalisation, it's much broader than those aspects.
Yeah, again, another very good question, and the answer is no. We want to have a very broad approach. And again, we will have failed if we're just aiming at traditional services, because traditional services probably in 10 years' time are going to look very different to what they do at the moment. We've got a PA framework. We're trying to challenge some of the models. So one of the models we've had, for instance, in supporting the training of the workforce is something called the Workforce Development Fund that's administered through Skills for Care. We asked Skills for Care to throw it open to personal assistants, but guess what happened? None applied because it's a very bureaucratic, very cumbersome process. So we've asked them now to experiment, basically to throw the rule book away and say, how do you get some of this money out so that individual employers are able to develop their PAs? And it is a little bit risky because we haven't then got the same audit trails that exist maybe with the old system, but we are real system.